Got a nasty stomach bug that won't go away. It could be a parasitic infection called cyclospora. The infection tends to occur in warmer months, May to August. It is popping up in several states, and Texas health officials are reporting more cases than what they normally see this time of year. So, how do you avoid the infection? KG11's Brianna Berry has what you need to know. Brianna?
Well, Harris County Public Health says there have been 18 cases of cyclospora so far this year, and that number is actually up from past years. So look, if you're planning a trip to the grocery store, there are a few things that you might want to just leave off your shopping list unless you can cook that food to the recommended temperature. That's because cyclospora is commonly associated with a couple of specific foods, but scientists, they don't know exactly what is causing the most recent outbreak. So when we take a look at some of the things that you maybe want to leave off the list, you do notice here that we have a couple salad mixes and kits, but then you see over here we've got fresh basil, fresh cilantro. Those are herbs, so we're going to talk about that in a minute, but also things like raspberries, which are difficult to clean. So these are some of the things you might want to consider. We talked to an expert, Dr. Wesley Long. He's the medical director of microbiology at Houston Methodist, and he says cyclospora is difficult to trace and stop. It's often found on foods like berries and herbs that are hard to clean. And even if you do, that bacteria is chlorine resistant, meaning regular cleaning won't always work. Now, some symptoms, they are similar to a typical stomach bug. We're talking bloating, nausea, and diarrhea, but it can go away and get better and then come back, sometimes lasting for months if it's not treated. Now, the relapsing pattern is key.
If it gets into the relapsing sort of situation like this, there's really no reason for someone to suffer with diarrhea for weeks or a month or more, because there are common antibiotics that are fairly affordable that treat this infection.
Now, I did ask Dr. Long about the chance of getting infected with cyclospora if you go to a water park or you're swimming in a public pool. He said, yes, it is possible because the bacteria is chlorine resistant, but it's more common outside the U.S. of that happening. The majority of our cases come from raw produce.
Now we know what to shop for. Thank you so much,